Thank you very much, Presiding Officer. First of all, I want to thank colleagues from across the Chamber for signing the motion so that we can actually have the debate this afternoon. I also want to commend the work of Fight Bladder Cancer, a relatively small organisation who are dedicated to raising awareness of the symptoms and support that is available for those diagnosed with bladder cancer. I first became aware of Fight Bladder Cancer shortly after the 2021 election, and I was delighted to host their first parliamentary reception in February 2023. This followed the organisation officially becoming registered as a charity in Scotland in July 2022. As I highlighted during my opening remarks at that event, Fight Bladder Cancer's work was first brought to my attention by one of my constituents, Laura Mackenzie, as she is an ambassador for the charity. She highlighted the charity's 4 main objectives to, first of all, support patients, their family and friends, and all people affected by bladder cancer, raise awareness about the causes and symptoms of bladder cancer so it can be caught early, campaign for and support research into bladder cancer, and finally affect policy at the highest levels to bring about change in bladder cancer diagnosis and treatment. Now, according to Fight Bladder Cancer, nearly 1,700 people are diagnosed with bladder cancer each year in Scotland. Now, the majority of them are people aged over 60 years old. Now, worryingly though, around 50% of bladder cancer cases are preventable. Now, that tells a huge story about the work that is required to highlight the symptoms of bladder cancer. So I want to take this opportunity to listen for awareness. The signs and symptoms to look out for include blood in your wee, which is the most common symptom of bladder cancer, urinary infections that don't respond to antibiotics, pain when weeing, needing to wee frequently, tiredness, abdominal pain, weight loss, incontinence, and lower back pain. Now, according to Fight Bladder Cancer's website, very few people will experience all of these symptoms, but that is why people should talk to their GP if they experience any of them. Now, other less serious conditions can have the same symptoms too, of course, but again, that is why it's critical that people do not delay and speak to their GP. Presiding Officer, in my opinion, it highlights the need to improve outcomes for patients with bladder cancer. Now, this is because, according to Cancer Research UK, bladder cancer is the 5th most common cancer in the UK, after breast cancer, prostate cancer, lung cancer and bowel cancer. However, a report from Fight Bladder Cancer states that, and I quote, "Survival for patients with bladder cancer has not improved over the last 3 decades, with certain groups affected by bladder cancer, including women, and those from lower socioeconomic backgrounds experiencing poorer outcomes." Now, other research referenced in the report states that bladder cancer patients experience a high rate of reoccurrence, long and invasive surveillance and expensive treatment. Now, patients also report worse overall experiences than most other common cancers. Now, this is not good enough for patients, but it's also costly for our health service, as bladder cancer has the highest cost of any cancer when considered on a per-patient basis. Presiding Officer, I believe that everyone in the Chamber agrees that prevention is better than the cure, and that could be said for anything, quite frankly. But this approach helps ensure that patients don't endure more invasive and extensive treatment, which is also more expensive to deliver. It's imperative then that we consider how we can support our NHS to better diagnose bladder cancer. And a key part of this, as I've already indicated, is making sure that we raise awareness of the key signs and symptoms. Now, I cannot stress that point enough, and I refer to a previous statistic, that half of bladder cancer cases are preventable. Now, part of that work then is considering how we maintain healthier lifestyles. And Fight Bladder Cancer have put together a range of resources to help with this. Now, according to NHS Inform, most cases of bladder cancer appear to be caused by exposure to harmful substances, which lead to abnormal changes in the bladder cells over many years. Now, tobacco smoke is a common cause, and it's estimated that half of all cases of bladder cancer are caused by smoking. It's almost 20 years since the smoking ban was introduced in Scotland, and that was a key public health policy that has helped massively in terms of shifting public attitudes towards smoking. Now, Scotland led the way in this policy in the UK, and I believe that when we are ambitious enough to want to lead the way, then when it comes to bladder cancer. In closing, Presiding Officer, I want to draw to attention the Fight Bladder Cancer White Paper from May 2024. This document includes a range of recommendations that are UK-wide, but there are takeaways for us in Scotland to consider. Now, while there is no one policy or action that will deliver all the changes that are required, there are key areas where we do need to effect change. Firstly, establishing an exemplar pathway for bladder cancer care to help deliver quicker referral and diagnosis for those with suspected bladder cancer. Secondly, strengthening the bladder cancer healthcare workforce will certainly help achieve better outcomes for bladder cancer patients. And we know that this is a key recommendation across several areas in the health service, and Scotland is not alone in facing staffing challenges. Now, thirdly, boosting awareness, support and participation throughout the bladder cancer pathway for patients, carers and also families, and ensuring that patients are empowered to make informed decisions about their care. Now, we know that taking a holistic approach to healthcare and keeping patients informed at all stages of their treatment journey is absolutely vital. Now, that could be said once again about any aspect of healthcare, but it helps them be invested in how they can make small lifestyle changes to support their treatment. And it also helps to safeguard their mental well-being during what really will be a very difficult time. So, Presiding Officer, I want to once again thank members for supporting the motion and also for those who are going to be speaking in the debate. I also want to thank Fight Bladder Cancer for their efforts to improve outcomes for bladder cancer patients in Scotland. And I look forward to continuing to work with the organisation to help deliver this in Scotland. Thank you.